On this episode of Putting Possibility into Practice, we're talking technology and innovation. Learn how a new partnership will benefit Greenway Health customers in the changing healthcare IT industry and hear from a customer on what technology and innovation means to their practice. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and I welcome you to this episode of our podcast, Putting Possibility into Practice. If this is the first time listening, we're glad you found us on your platform of choice, and we invite you to subscribe to this podcast on your platform of choice so that you get notified each week when new episodes are uploaded. And if you are a returning listener, thanks for tuning in once again. This episode, as I mentioned, we are talking about technology and innovation, a new partnership between Chime and Greenway Health, which was announced recently. We'll get into that partnership and what that means in regards to technology and information. We'll also find out all about Chime from its executive director, and we'll hear from a Greenway Health customer on what technology and innovation means to their practice as they continue their growth in over 35 years of existence. So without further ado, I want to first welcome the Executive Director of Chime, Jonathan Fritz. Jonathan, thanks for taking time out of your day to join us.
You're welcome. Thank you very much for having me.
First, for listeners who may not be familiar with Chime, what does Chime stand for, and what's the organization all about?
Sure. It is quite of a mouthful, but Chime stands for the College of Healthcare Information Management Executives. It was founded roughly 27 years ago, primarily by senior healthcare IT executives, mostly CIOs and healthcare provider systems. Over time, the vision, mission, and membership has been refined, and our vision really is exceptional leaders transforming health and care. And that ties in very closely, I believe, to the overall mission of the organization, which is really to advance the role of senior health IT and innovation leaders through the combination of education, collaboration, as well as advocacy in support of improved health and care worldwide. A little bit more information about our membership. We have nearly 3,000 members that are located in about 52 different countries, and that's expanding considerably. The majority of those members are CIOs in provider systems, but they also include other senior IT and innovation leaders, several that include Chief Innovation Officer, Chief Digital Officer, and a whole host of other senior executives in healthcare organizations. Another thing I think would be interesting to the leader or to the listeners would be our recent expansion internationally. And during our CIO forum last week, we did announce the expansion into Canada as well as the UK, and there are several other formal agreements coming to increase our chapters throughout the globe. One of the important things also about Chime is that it really is a strong relationship organization where very significant bonds are created amongst the members as well as our partner firms. Our partner firms are part of what we refer to as the Chime Foundation, and within the foundation there are about 160 of the world's most influential healthcare technology and services firms. And we are very proud and happy to consider Greenway as one of those.
And in talking about Greenway and technology and technology and innovation, I also want to welcome to the podcast our Chief Technology and Innovation Officer. He is Durgampudi, new to Greenway Health, so we welcome you not only to Greenway, but I think for the first time on our podcast. And talk a little bit about how you became affiliated with Chime.
Yeah, thanks, Joe. Thanks for having me, and nice to have Jonathan here with me. I've been engaged with Chime for over now 7 years in various capacities. I've really grown to value the relationship, as Jonathan said, from a Chime relationship building as part of Chime, and I've have many friends and relationships have been formed at Chime. I was an executive sponsor from a partner firm to begin with, but then I volunteered for many roles, just like Jonathan did. I was also part of Chime board for a year, and then I was also part of an international advisory board as well. And now I'm partnered with Jonathan to move the mission of innovation for all of us together.
And we'll talk more about what that means to Greenway Health customers in just a moment. But Jonathan, with technology and innovation paramount in the changing healthcare environment, what does it mean to you as executive director when we speak of technology and innovation in the healthcare landscape?
Innovation has always been a very significant part of my life, and it's always been part of my overall career thread and therefore passion. I'm a recovering patent and startup business attorney, an investor, and an entrepreneur. And healthcare has always been part of who I am. Both of my parents are clinicians. I personally have a life sciences and biomedical informatics background as well as my legal background. So healthcare and innovation have always been part of who I am. So this really is something I'm passionate about and very excited to be part of Chime's global innovation initiative and to be able to work with partners like Greenway. Given the dynamics of Chime as a leadership organization, we really do have an opportunity to positively impact health and care through two main pillars: education as well as innovation facilitation. And when I talk about innovation, the way that I view it may not be necessarily the way that everybody views it. And there are so many different definitions for it, but I really do view innovation as a spectrum. It doesn't require shiny technology such as drones, AI, blockchain, etc., but it most certainly can. However, innovation is also about creatively solving problems with meaningful and measurable results. Chime is an excellent position to really help our members, help our foundation members, really advance all types of innovation in healthcare. So it's really exciting to me to be in this position such that we can advance the innovation globally.
And in talking with technology and innovation, I want to welcome in one of our great customers, Medical Colleagues of Texas. They serve the Katy, Texas area, and to talk a little bit about technology and innovation, what it means to them, and how they use it each and every day to provide and enhance patient care. I bring in their practice administrator, Ethan Bing. Ethan, thanks for joining me on this episode.
Thank you for having me, Joe.
Ethan, real quick, just a little bit about the practice. I mentioned Katy, Texas, but for those who may be unfamiliar with the area, where is Katy located? And talk a little bit about Medical Colleagues of Texas and what you guys offer the community.
Certainly. Katy, Texas is about 30 miles west of Houston. We have been in the area since, I'd almost say the early 20th century. We had several of our physicians and my great-grandfather that practiced on horseback, doing house calls and performing surgery on kitchen tables, all the way up until today, where we are an 11-physician practice. We have about half of our physicians as primary care. We have pulmonary disease, gastroenterology, and OB-GYN. We have a lot of history taking care of the football teams and other sports players with the Katy ISD school district, which we've loved to take care of them and be on the sidelines and support the community in that way.
So with so much history, technology and innovation, a lot has changed since the early 20th century. What does technology and innovation mean to the practice?
So for us, it really comes down to being able to meet the needs of our patients and operationally have better operations. That's really what it comes down to. We don't necessarily think the newest, shiniest, sleekest tool that gets released is even useful until we actually need it. We've been very slow adopters, but I think we've adopted them at the right times and really committed ourselves to them. So, for example, my grandfather used to have no record system. He had a general ledger book where he was recording office visit, and it was a 50-cent charge up until when we got Medical Manager, which was a billing software. And then all the way up until our current partnership with Greenway Intergy, where we have a full suite of EMR and patient communication tools that people really need in these days to maintain their records, make sure their care is paid for, and for us to be able to contact them effectively when we have such a big patient panel.
Anything, talk about the partnership with Greenway. You just alluded to the transition from Medical Manager way back when to Energy on your current platform. How important is it to have a partnership in place to stay on top of innovation and technology in this digital healthcare world?
I think the relationship is incredibly important. Honestly, I don't think any electronic medical record system is perfect. Human bodies aren't perfect, and so I don't know how we could serve them in a way that makes it perfect. But honestly, our relationship with Greenway has allowed us to get much better at treating patients, in the sense that we've been on the platform for 10 years now, or over 10 years, and our workflows have been truly integrated into the software, and it's continuously being improved and updated so we can squeeze out that extra bit of operational efficiency, and of course now contact our patients directly, contact lab companies by sending orders, pharmacies, etc. So it's gotten better as time has gone on.
And Kali, what does this partnership mean for Greenway customers and for Greenway as an organization when we talk about technology and innovation in healthcare?
Yeah, as Jonathan said, innovation is not only about some of the technologies and the latest and the greatest in the world, but also creating an ecosystem that we all can innovate and benefit from. So what we are looking from a Greenway standpoint and also from a Chime standpoint is we want to create an ecosystem that we can together innovate and move forward and learn and grow and use the innovative technologies that are being developed elsewhere in enhancing health and care. And so I believe that we have a great opportunity to partner with Chime in building that ecosystem because it's a very unique type of ecosystem that I don't believe exists today, frankly, anywhere else in the industry. So that's going to benefit us, Chime members, our customers, and the healthcare industry as a whole.
And Jonathan, we talked about the partnership that was recently announced. What does it mean when somebody partners with Chime, an organization such as Greenway?
I have to say that I personally am very pleased that Greenway is a Chime Innovation partner, partly selfishly because I consider Kali a good friend of mine, and it means that I get to work closely with him. He's a very talented guy, and I know that he's going to continue to have a very positive impact through Chime, as well as being a member of the Chime Innovation Advisory Board. Something that Kali had mentioned regarding ecosystem also ties into culture and developing innovation culture within our membership organizations, meaning the members that are primarily healthcare IT and innovation executives. We have the ability to help them create a culture of innovation within their organization. We also have the ability to help our foundation firm members, such as Greenway, to help create that ecosystem as well as that overall culture of innovation. When it comes to partnering, personally, my goal is to work alongside our partners to create a relationship that is really aligned with their strategic goals and initiatives. In particular, Greenway saw the importance of educating our members and CIOs on innovation frameworks. So it was really a natural fit that as part of the overall partnership that we crafted, Greenway is the exclusive sponsor for a workshop that we're putting on next month at our Intermountain and Chime Innovation Center. And that workshop is around developing an innovation framework. It's a small cohort-based workshop that's designed to teach innovation processes and give our members practical tools to start using the very next day. And the fact that Greenway sees the importance of that and sees that as part of the overall ecosystem and how to connect not only with our members, but with our foundation firms and overall help the mission and vision of Chime, we're very happy and pleased to be partnering with Greenway.
And I'll ask both you guys this question, and Jonathan, you can comment first. But as we were just talking about education, how is Chime shaping the future of healthcare IT leaders? And then I'll turn to Callie on talking about Greenway's support of education initiatives to further the development of healthcare IT leaders. Excuse me.
Yes, I've mentioned that our members are primarily the senior most healthcare IT and innovation executives within their organizations. Under the Chime umbrella, we also have 3 other groups, and we affectionately refer to them as the A groups, AHIS, AHIA, and AHIT. And these are primarily around security, applications, and technology. So from the security standpoint, the CISOs, the Chief Information Security Officers, applications, Chief Application Officers, and then technology, the Chief Technology Officers. And in many of the provider systems, these executives report up to our Chime members. And so we've created these groups, and I think that the total membership of these groups are getting close to 1,000, and we just formed these several years ago. And so we were creating these separate organizations to educate those specific leaders within healthcare IT. And that ties into our certification programs. We have a certified healthcare CIO certification, as well as one for our foundation firms, CFCHE, the Chime Foundation Certified Healthcare Executive, which actually both Kali and I have that certification. And this ties into the boot camps that we have, which are 3 or 4 days intensive training, as well as various other education opportunities to not only educate our members that are the senior most IT executives, but also those that are the next 1, 2 levels that are up and coming leaders. We've also been forming a new executive education series, which is essentially the next level, the higher level of focused education for our Chime members. So we really do have this great continuum of education for Chime members as well as for our foundation firms. Another event that we do have that's focused around our foundation firm members is CPES, which is typically in the fall, and it's really focused around helping our foundation firm members, acclimate and interact with our members better and try and maximize the engagement and partnership with Chime.
Yeah, and just to add from a Greenway standpoint, so our opportunity obviously is from a relationship standpoint, but we are specifically excited about programs like focus groups. We get to conduct focus groups with Chime members and CIOs where we can learn together, but also we get to interact and actually solicit their feedback on either new concepts that we're working on, current concepts that we're working on, or new ideas that we might have. So that's another example, just one example of the benefits that we explore together apart from the innovation framework.
And what's in store for Chime for 2019? In these final 9 months or so of the year.
We're pretty excited. We have a number of new events and education opportunities that are coming up. I will have to say that we've got a phenomenal public policy group that are full-time folks for Chime in Washington. Really outstanding. One of the things that they had recently done was provide perspective to the Senate, to the U.S. Senate, on 5G technology and the impact that it's going to have on healthcare. And we recognize that there are advancing technologies and really changing dynamics that not only are going to impact our members, but also there are policy elements of it that are important for us to be tied into. From an innovation perspective, we're going to be launching a brand new event called CI2O Innovation Summit. I is squared, information, innovation. So we're really looking at the intersection of IT and innovation leaders, where a lot of the lines are blurring there because many of our IT executives are owners of innovation in their firms. But we're really excited about this. It's going to be in September, and it bringing those executives together to really advance innovation within their organization and to be able to work better, more efficiently with firms that are advancing technologies and solutions in healthcare technology and innovation. We have a phenomenal group that is referred to as the Opioid Task Force. I can't do it proper justice on the podcast here, so I really would love to have people take a look at our website. But really, the initiative is around engaging our collective leadership to identify and really take deliberate action to avert the increasing addiction and growing mortality of the opioid crisis. So really would love listeners to go to our website. You'll see it on the front page. Click on it. We've got some multimedia to describe everything that we're doing. And it's a great cause. Really would appreciate folks to donate. I personally have donated as well. So we've got our fall forum. We've got a multitude of other events and exciting things coming, and really would appreciate folks to take a look at our website.
Perfect. Well, thank you, Jonathan, and that alludes to my concluding point. For more information on Chime, you can visit their website at chimecentral.org. All of the information we talked about, the upcoming educational series and the Opioid Task Force, right on the homepage. You can learn more about all that they are doing at Chime. That's chimecentral.org. And for the product solutions that Greenway Health offers its customers and how we're staying innovative on the technology front, you can visit our website at www.greenwayhealth.com. I want to thank all my guests, Jonathan and Callie included, for appearing on this episode of Putting Possibility into Practice. If you've enjoyed this episode, and I hope you did, I do once again invite you to subscribe on your podcast platform of choice, and we're on a number of them, including iTunes, Google Play, Stitcher, FM.Player, SoundCloud, Spotify, Libsyn, and more coming soon. I'm Joe Augustinelli, the social media manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.